Game-based learning has been utilized in the world of clinical education and medical continuing education. Teaching med school students, doctors, nurses, and support staff the skills they need to know in order to properly practice medicine is an enormous task. Game-based learning has been adopted in the medical industry partly due to changes in policy and clinical education, which has ultimately reduced the amount of time spent with patients. A variety of training solutions have been adopted in order to develop and enhance skills at such things as interpersonal skills, diagnostic skills, and surgical procedures. Let's look at some examples. A study conducted in 2009 aimed to compare the differences between teaching third-year medical students pediatric content in games compared to self-study using flashcards. While the students in each group performed the same, students favored the games as a more enjoyable way to learn the content. What we can take away from this study is that game-based learning may create a more enjoyable learning environment for the learner. In the second example, two games were used during a first-year pathology course at the University of Saskatchewan to evaluate two things: their instructional effectiveness and their impact of learner satisfaction. Both games had a game show type structure where learners made wages and answered questions for prizes or some sort of reward in the game. Learner satisfaction during the study, as shown by this chart, indicates that students who played the games during their pathology course had a higher level of satisfaction and preferred the game as a learning tool. After exploring the medical sites in the WebQuest and viewing this presentation, can you identify some pros and cons to gaming in the medical field? Be sure to complete your scavenger hunt regarding this section and then move on to any remaining fields you have not yet explored. You can close this window or click on the Back to WebQuest icon to return to the WebQuest.